Our group was interested with the data that could be analyzed in terms of the correlation between health spending in countries and their child mortality rate. We wanted to see if there was a direct correlation or not between the two factors. Our initial thought that was the countries with higher spending on healthcare as a percentage of their GDP would in turn have a lower child mortality rate. As we investigated more into the data that Gapminder has to offer, we discovered that there is not much correlation between the two factors. Although we do see that with time, the overall child mortality rate has seen a decline in almost every country that Gapminder has provided data for. Let's take a look at the timeline of these countries and how the health spending has changed in correlation with child mortality rate. Now that you've seen the progression, let me talk a little bit more about Gapminder. On the y-axis, we have a total health spending. On the x-axis, we have child mortality. Gapminder's information of total health spending is the sum of public and private health expenditure as a percentage of GDP. Child mortality is death of children under 5 years of age per 1,000 live births. As you can see, the total health spending does not exceed percentages over 22 for any country, which is fairly standard. We chose to analyze total health spending and child mortality under their respective axes because child mortality is much easier to view along the x-axis to really see the depth of change with time. More specifically, we want to focus in on impoverished nations, referring to poor or low-income nations. Let's quickly highlight a few impoverished nations for us to analyze. Niger, Haiti, Rwanda, and the Central African Republic. Let's watch how these countries have progressed since 1995. Right away, you can start to identify a small but positive pattern. Every country starts to move to the left, and at some point with respect to time. This means that we can conclude that of these few impoverished nations, at some point between 1995 and 2010, the child mortality rate has decreased. This is very interesting because immediately we don't see a correlation between a higher total health spending and a decreased child mortality rate over time. One would think when a country spends more of their GDP on healthcare, they would have lower child mortality rate. More children would be healthier, there'd be less deaths during birth. Impoverished nations face an interesting dilemma, however, because of how low their GDPs are. For example, Rwanda has a current GDP of $1,782. The gross domestic product is less than $2,000, which is for one single individual. The United States currently has a GDP per capita of $57,466. Those numbers do not account for the population because they are already per capita. Let's take a look over at the United States. It is almost astonishing to compare how much the United States could spend on healthcare as a percentage of their GDP versus a country like Rwanda or Haiti. Not only do we have to think about how impoverished nations have so little and that a portion of their GDP needs to spend on healthcare, but how they are to account for all other spending such as education, welfare, and even defense. In the case of these impoverished nations, let's assume that having a higher total spending on healthcare decreases child mortality rate. Now from the data, let's see if this assumption makes sense. So we have somewhat of a contradiction. We can see that while Rwanda moves at a somewhat steady negative positive slope, Haiti continues to have a steady, if not less, total health spending than they did in 1995, although their average child mortality rate does decline. This can be for several reasons. Most likely the best reason is an advancement in technology that is allowing childbirths to be more successful. According to the United Nations Population Fund, since 2010, Haiti has found a child mortality rate of only 59% because of increased healthcare facilities, availability of healthcare, and a surge in technology allowing for childbirth to be less fatal. Well, according to the data before 2010, the total spending on healthcare did not change from the United Nations Population Fund. We know that the 2010 medical facilities were built which aided the child mortality rate. This produces an alternative narrative compared to what we would think of higher spending on health GDP would be lower child mortality rate. Because we can observe from 2010 to the present, the United Nations Population Fund has aided Haiti which is why they are seeing lower child mortality rates, but with no change in spending. Let's take a look at 2009 and 2010 for Haiti. We can observe a huge spike in child mortality rate, and we also know that a large-scale earthquake hit Haiti in January 12, 2010. After the earthquake hit, relief from the UN and several other organizations helped create better medical facilities in Haiti. This has allowed for child mortality rate to decrease without having to increase GDP spending on health. The official government death toll was 300,000 deaths. This had a huge effect on child mortality rate because the data we are looking at is child deaths up until the age of 5 out of 1,000 live births. From looking at Haiti, we can conclude that a decrease in child mortality rate is not a result of higher total spending on healthcare in impoverished nations, which is exactly the opposite of what we expected to observe. This may or may be true for countries that are wealthy and not considered impoverished or experience high volumes of low income. Going back to the example of the United States, this would appear to be an outlier due to the high GDP spending on health, but has still significant child mortality rate, as say compared to Iceland, which has a lower spending on GDP as the US, but a much smaller child mortality rate. Why the US is such a significant outlier is a completely different question, but is a great example that this trend is not universal. The fact is that these impoverished nations face a challenge of how to succeed with a much more insignificant GDP than other countries that can afford to spend 15 to 20% of their GDP on healthcare.